If you don't masturbate in old age, this will happen to you. Intro. What if one of the most private things a man does is also one of his best, most misunderstood, shields against the wear and tear of aging? Imagine a function in your body that, when you stop using it, doesn't just quietly fade away. Instead, it kicks off a slow, silent chain reaction of physical changes. These changes can affect everything from that tiny gland below your bladder to the very hormones that control your energy, your mood, and your sense of vitality. Most men, as they hit their 60s, 70s, and beyond, are never told this. They just assume that a decline in sexual function is inevitably a footnote in the story of getting older. But what if that's not the whole story? What if stopping this one specific activity, masturbation, isn't just the end of something, but the beginning of problems you never saw coming? I remember a patient in his late 70s sitting in my office, completely frustrated by a handful of symptoms he couldn't connect. He had trouble with urination, a constant lack of energy, and just a general feeling of being flat. He'd chalked it all up to getting older. But when I asked him about his sexual health, specifically about self-pleasure, he looked at me with a mix of surprise and embarrassment. He admitted it had been years. Like so many men, he just thought that chapter of his life was over. He had no idea that this quiet decision to stop could be linked to the very issues that were draining his quality of life. This isn't about shame, it's about science. And what the science tells us is that for an older man, giving up on this act isn't a passive choice. It's an active one with real consequences for your physical and mental health. Section 1. The Unspoken Truth about Men's Health in Aging. My name is Dr. Alistair Finch. For over 30 years as a urologist, I've specialized in the complexities of the male body as it ages. I've guided thousands of men through some of the most personal health challenges they'll ever face. And one of the most consistent things I've seen is a deep silence around a key part of men's health: the role of self-pleasure in the later years of life. For generations, this topic has been buried in taboo. It's dismissed as a teenage habit, or, at best, something just for fun with no real impact on a man's health. This silence is a huge disservice. It stops men from understanding a basic biological truth. Your sexual systems are not separate from the rest of your body. They're woven into your hormones, your heart health, your brain, and even your emotional well-being. Ignoring this system is like deciding to stop using one of your arms. Over time, that arm will get weaker, its circulation will get worse, and it won't work as well. The body is efficient, it doesn't waste resources maintaining what isn't being used. When a man gets into his senior years, he's usually focused on a checklist of health concerns: blood pressure, cholesterol, joint pain, and of course, his prostate. He gets his checkups and takes his medications. But almost never does the conversation with his doctor turn to the health of his sexual function in a proactive way. It's usually only talked about when something goes wrong, when erectile dysfunction shows up, or when urinary problems become impossible to ignore. This is about changing that conversation. It's about getting past outdated ideas of shame and looking at this through a clinical, scientific lens. It's not just about pleasure, though that is a perfectly healthy part of life at any age. It's about physiological maintenance. It's about understanding that this private act serves a purpose. It sends signals to your body to keep essential systems online. When those signals stop, the body begins a slow but steady process of shutting those functions down. And the consequences are much bigger than most men realize. This isn't about an obligation. It's about being empowered by knowledge, about understanding what your body needs to keep working well. Section 2. The prostate gland. Your body's forgotten, century deep, inside the male pelvis, sits a small walnut-sized gland that most men don't think about until it causes trouble. This is the prostate. Its main job is to produce the seminal fluid that nourishes and transports sperm. As men age, the prostate often becomes a source of worry. We hear about BPH, which is a enlargement that can squeeze the urethra and cause frustrating urinary issues, like a weak stream or having to go all the time. We also hear about prostatitis, which is a painful inflammation. And of course, there's the constant concern of prostate cancer. So, where does masturbation fit in? It's all about flow. Think of the prostate as a tiny factory that's always producing fluids. Ejaculation is the factory's regular clean-out process. It flushes the ducts and tubes inside the prostate, preventing a buildup of old cells and potentially harmful stuff. When ejaculation is infrequent or stops, these fluids can sit in the prostate for longer. This creates a stagnant environment, where inflammation is more likely to happen. Regular ejaculation helps keep the prostatic ducts clear and the tissue healthy. This leads us to some of the most interesting research in this field: the link between how often a man ejaculates and his risk of prostate cancer. Several large studies have looked at this. One of the most famous is a long-term Harvard study that followed almost 30,000 men. The results were pretty eye-opening. The study found that men who ejaculated more often, 21 or more times a month, had about a 20% lower risk of developing prostate cancer, compared to men who only ejaculated 4 to 7 times a month. Now, this is a correlation, not a direct cause and effect. We can't say for sure that not masturbating causes prostate cancer. But the leading theory is that regularly flushing the prostate is protective. By ejaculating, you might be helping to clear out potential carcinogens and reduce inflammation before cells have a chance to become cancerous. Think of it like changing the oil in your car. You do it to flush out gunk and keep the engine running smoothly. In a similar way, regular ejaculation might just be a form of preventative maintenance for your prostate. For older men, whose bodies have had a lifetime to build up toxins, this flushing could be especially important. So, when you stop this activity, you lose a natural, built-in protective mechanism. It's a silent risk, one that builds over months and years, but it's very real. Section 3. Hormonal balance and the myth of declining vigor rate. Defining part of male aging is the slow drop in testosterone. It's a natural process that starts around a man's 30s. This decline is behind many of the changes men feel: less muscle mass, more body fat, lower energy, mood shifts, and of course, a lower sex drive. Many men just accept this. They see sexual activity as just a result of their testosterone levels. When their drive fades, they figure that part of their life is over. But that view misses a key part of the feedback loop. The relationship is a two-way street. Sexual activity isn't just a consequence of hormones. It can also be a driver of them. While a single orgasm won't permanently spike your testosterone, research points to a more supportive relationship. Sexual arousal and orgasm stimulate the whole system responsible for testosterone production. Some studies show that testosterone levels can temporarily rise during sexual activity. Think of it as keeping the engine of your hormone factory warm and ready, instead of letting it go cold. When an older man stops all forms of sexual activity, he's removing one of the natural prompts for his body to produce testosterone. This won't cause a sudden hormone crash, but it can contribute to a faster or steeper decline. It's another brick pulled from the foundation of your vitality. The fatigue you feel, the trouble maintaining muscle, the dip in your mood, all these can be made worse without the hormonal support that regular sexual activity provides. I've seen this pattern in my clinic over and over. A man comes in complaining of classic low testosterone symptoms. He's tired, he's gained weight around his middle, and he's lost his spark. When we talk about his lifestyle, we often find his sexual activity stopped years ago because he thought he was too old for it. He didn't realize that by letting go of that part of his life, he was also letting go of a natural way to support his hormonal health. It's not about trying to have the testosterone levels of it's about taking part in a biological process that supports a healthier hormonal balance for the age you are. It's a tool, right alongside diet and exercise, for aging with vigor. By staying engaged, you're sending a message to your body: we're still active, we're still vital. Keep the systems running. The circulatory system and pelvic health, use it or lose it. Re-examinate phrase, use it or lose it, gets tossed around a lot. But for the sexual anatomy of an aging man, it's the simple truth. A man's biggest fear as he gets older is often the loss of erectile function. At its core, an erection is all about blood flow. The penis is made of spongy tissues that fill with blood, making it firm. This whole process depends on healthy, flexible blood vessels. So what happens when this mechanism isn't used regularly? The network of blood vessels in the penis needs regular exercise. Arousal and orgasm send a surge of blood to the entire pelvic region. This nourishes the tissues with oxygen and helps keep everything flexible and responsive. When you stop masturbating, you stop giving the area this regular vascular workout. Over time, this lack of use can lead to a gradual decline. The tissues can become less elastic, and the blood vessels might not respond as well. This is sometimes called penile atrophy, where the tissues lose some of their function from simple disuse. It's a slow, creeping change you might not notice month to month. But over a few years, you could find that erections are harder to come by. It's not that something is suddenly broken. It's that the system has fallen into disrepair from neglect. But it's not just about the penis. This increased blood flow nourishes the entire pelvic region, which brings us to the pelvic floor muscles. These are the muscles that support your bladder and bowels, and they also play a key role in sexual function. During an orgasm, these muscles contract automatically. This makes regular masturbation a targeted workout for them, helping keep them strong. Why does this matter for an older man? Weak pelvic floor muscles are a main cause of urinary incontinence, embarrassing leak when you cough or sneeze. They can also contribute to erectile dysfunction, since strong pelvic floor muscles help keep blood in the penis during an erection. When a man stops masturbating, he loses this automatic workout for his pelvic floor. This can contribute to a gradual weakening, putting him at a higher risk for both urinary and sexual problems. Section 5. Beyond the physical, the brain, mood, and sense of self. While the physical effects are clear, what happens in a man's inner world, his brain chemistry, his mood, his sense of self is just as important. For many older men, the later years can bring isolation, a loss of purpose, and a higher risk of depression and anxiety. An orgasm isn't just a physical release. It's a powerful chemical event in your brain. Your brain gets a flood of feel-good chemicals. Endorphins, the body's natural stress relievers, are released. Dopamine, the pleasure neurotransmitter, surges. And oxytocin, the bonding hormone, creates a feeling of calm and contentment. This chemical cocktail is a potent, natural stress buster. It can ease anxiety and often helps you sleep more deeply. When masturbation stops, so does the regular delivery of this mood-regulating mix. It doesn't mean you'll suddenly get clinical depression, but it does mean you've lost a reliable coping tool. The man who had a natural way to distress now has one less tool in his emotional toolkit. Over time, this can lead to what some of my patients call a flattening of their mood. Life can just seem a little more gray. And finally, we have to consider the role sexuality plays in a man's identity. From the time we're young, it's a core part of how we see ourselves. As men age, partnerships might change and physical abilities shift, but the need for a connection to one's own body remains. In this context, masturbation is an act of self-intimacy. It's a private affirmation that says, I am still a vital, sexual being. My body is still a source of pleasure. Giving this up, especially because of shame or a mistaken idea that it's no longer appropriate, can lead to a deep sense of loss. It can reinforce the feeling that you're over the hill. This act of self-pleasure, when you see it as self-care, is a powerful weapon against the emotional wear and tear of aging. CTA section urologist's practical advice. Okay. So understanding the consequences is the first step. The next, more important step is knowing how to approach this in a way that's safe and beneficial for your aging body. Let's replace the old myths and shame with some practical, clinical advice. First, focus on mindfulness, not mechanics. For many men, masturbation has always been about the finish line. In older age, that mindset needs to change. It's not a race. It's a chance to connect with your body and notice sensations. Think of it more like stretching or deep breathing, a form of self-maintenance, not just a release. This takes the pressure off, which actually helps with sexual response. Second, your technique matters. An aging body is different, skin is thinner, and more delicate. The aggressive techniques of your youth might now be a bad idea and could even cause irritation. The answer is to be gentler, and lubrication is not optional. It is essential. Using a quality lubricant reduces friction and can dramatically increase comfort and pleasure. Third, let's talk about finding your rhythm. Patients always ask, "Doc, how often?" There's no magic number. That 21 times per month from the Harvard study is research data, not a prescription. What's more important than hitting a target is consistency. Regular, moderate activity is what seems to help. For some men, that's a few times a week. For others, once a week is fine. Listen to your body. It's far better to have a gentle session once a week than to force it out of obligation. Just try to maintain a baseline of activity to keep the systems engaged. And finally, you have to work to overcome any guilt or shame. Many men in their 60s, 70s, and 80s were raised to believe that masturbation was a moral failing. These old ideas can cast a long shadow, causing guilt even when you know it's a normal, healthy act. I urge you to consciously reframe this. See it not as an indulgence, but as part of your health regimen. It's an act of self-respect, a way of caring for the body that has carried you through your entire life. Conclusion: we've looked at the male body, from the tiny ducts of the prostate to the complex pathways of the brain. The takeaway is pretty clear. For an older man, masturbation is much more than a fleeting moment of pleasure. It's an act of physiological maintenance, with benefits that rippled through his entire body. It's linked to better prostate health. It supports a healthier hormonal balance. It acts as physical therapy for the crucial systems in your pelvis, preserving both erectile and urinary function. And it's a powerful tool for your mental and emotional health. To stop this activity isn't a neutral choice. It's a decision to let these systems go dormant, to let them decline faster than they have to. Of course, this is a deeply personal choice. No one should feel forced. But it's a choice that should be made with open eyes, knowing exactly what's at stake. It's time to bring the conversation about aging and sexuality out of the shadows. Honoring your body's natural functions isn't a sign of immaturity. It's an act of profound wisdom and the ultimate form of self-care.